The Big 12 tournament was one of the first casualties of the pandemic. 3 years ago, Thursday's games were canceled as teams warmed up.
We'll never forget it. Long after the entire NCAA tournament was canceled, March Madness over. Fox 4's Reagan Porter today talked with experts on where we are and what we've learned from empty seats 3 years later.
3 years later, doctors here at the University of Kansas Health System and local health officials say we've pretty much exited the pandemic, but there's still a need to be cautious.
Most people have moved out of the pandemic in regards to it affecting their everyday life.
This week, 3 years ago, the first patient in the Kansas City metro faced a COVID-19 diagnosis. The Big 12 tournament canceled, marking the start of the pandemic in our community.
And it's a very emotional decision, and seeing those athletes come off the court with tears dripping off their chins because that was going to be their final game. And now to see the tears of excitement and their joy and emotion, feels like we're back and we're back and we're bigger.
It's great to be able to see that and get back towards more of that social.
Dr. Dana Hawkinson says in returning to a pre-pandemic lifestyle, we must also remember the vulnerable population. Some people are still getting sick with COVID and needing hospital care.
At one point in the past couple of years, we were down to like 1 or 2 patients in the hospital. Recently, we've been hanging out in those 20s as far as active infections.
Hawkinson says the disease spectrum has changed, meaning the vast majority of people coming in with COVID are high-risk patients.
And certainly age plays a factor in there, but other comorbid conditions like diabetes, obesity, lung disease, heart disease. But now we also have the tools to help prevent that and help reduce your risk as an individual for that helping. And the best one, obviously, is vaccinations.
In Johnson County, where the first COVID patient lived, the current vaccination rate is more than 80%, and a little less than 1 in 4 have received their booster. That's according to the CDC. Elizabeth Holshoe is with the health department. She says that data may not be completely representative of what's happening in the community, much like current COVID testing data.
We still need to be cautious at times, and we need to be protecting ourselves and protecting others, particularly when we're sick. And I think that's just a general attitude that I'd like to see us all moving forward to.
Doctors continue to say masks are good. If it makes you feel more comfortable, wear one. And if you're sick, stay home. Reagan Porter, Fox 4, working for you.